I'm Chris Cooney, and it's my pleasure to welcome you to our 19th month of COVID recovery and resource calls. I have to say it's feeling better out there. I hope you're all feeling that too. A lot more gatherings, both in person outside and also now inside. Chamber's looking forward to celebrating our 108th annual meeting coming up 2 weeks from Wednesday on November 10th. And we hope many of you will join us. We've reduced capacity and we are already close to selling out with 300 seats. So that again is reduced capacity in that facility by about 40%. Anyway, we are delighted to have with us representatives from the local, state, and federal governments today to talk a little bit about some of the resources still available and on the horizon for assistance to small businesses in our region. And I think as we do traditionally, we will begin with Sue Joss to give us a health update. As many of you know, we will be conducting a mayoral forum immediately after this update series, and we should be on to that by about 2:20. We're expecting the mayor to be on shortly. Candidate Tina Cardozo is with us already. We have already pulled for the order of candidates opening and closing remarks. And again, we look forward to that. In the meanwhile, we will provide an update on the health and also on resources at the state and the federal level. So delighted to have you with us, Sue Joss from the Brockton Neighborhood Health Center. Can you give us a sense, should we be feeling better about everything related to COVID?
I think so. We're not out of the woods yet by any stretch of the imagination, but the numbers are looking better. So I thought I'd start off with explaining why I'm wearing pink, and it's really pink, isn't it, today. So the health center is recognizing breast cancer awareness today. And next month, we're recognizing diabetes awareness. And the reason I bring this up on the COVID update is as COVID starts to wane, and we hope that that trend continues, really urging everyone to start paying attention to all of the other health screenings and treatment and concerns that you have been ignoring and avoiding during the pandemic. And I know most of us have done that, including me. So it's time to schedule your physicals, your dentist visits, whatever else you've been putting off. Because what we found here at the health center is that because our capacity was taken up treating COVID because people were afraid to go anywhere for fear of catching the disease, many people have put off things that for much longer than they normally would have. So my message today is that it's time to get back to all of those things. Absolutely, though, without forgetting that COVID is still out there. So here's where we are today. And thanks again, as always, to Dr. Rick Herman from the Board of Health for the slides. He monitors these very carefully and has a great set of slides here. So, so you'll see here that the trend is looking good. And if you look to the far right, the most recent downward trend, you've seen it come up and down. Late June, early July, we thought this was over, and then all of a sudden we got the next spike. So it does seem to be trending up and down, but the highs have not been as high. So hopefully we're on the downward path on this. Interestingly, the hospitalizations, though, haven't gone down. And what we look at for the local hospitals really being able to handle the pandemic without restricting other types of services is we like to see it at or below 5%. So it has been for several months, but interestingly, it's not going down beyond that 5% mark. If we get above 15%, that's when the hospitals really have to start thinking about diverting patients. The state needs to open up additional beds, that kind of thing. So luckily, we haven't been at that level for quite some time. Deaths in Brockton, I believe the total count right now is around 444. So again, we thought we were out of the woods and then had a little bit of a spike in September. So far, 2 deaths in October. This is the positivity rate. So again, we're starting to see a nice trend downward. Hopefully that'll continue. Brockton's at 2.31% as of yesterday. And this takes a look at where the cases are popping up. So you'll see this is for last week, this is actually for the week that ended Wednesday, 21 breakthrough cases, 21 cases that seem to come from clusters. Could be a school, a restaurant where they had more than one, that kind of thing, a workplace. Catching it from each other in the household, 16. And then the bottom, the bigger group is basically people that we don't have data on. So this was yesterday's city dashboard. You'll see that the average daily cases was down to 16. Just to put that in perspective, in January, we hit 95 or so. So it is pretty far down. The positive test rate heading toward, if we get below 10 cases a day, we're already below a 4% positivity rate. That would bring us down into the green. So it's the cases per day that are keeping us up in the yellow right now, but it is coming down. Currently, there are 16 people in the hospital. 2 of those are in the ICU. This is how the surrounding towns are doing. West Bridgewater has seen a bit of an uptick and a surge lately. Everyone else is in the yellow. No one in the green right now.
Wow.
This is the vaccination rate. Brockton's doing pretty well. So if you look at the other gateway cities in the southern region, Brockton actually has the highest vaccination rate compared to Attleboro, Taunton, Fall River, New Bedford at 77.6% with at least 1 dose, 64.8% of the total population. The difference there is the under 12-year-olds, so the children obviously haven't been. And the positivity rate in Brockton is lower than the rest of the comparative group as well.
That is good news. That is extraordinary.
It is. And here's what the vaccinations look like. This is the eligible population. So this is age 12 and up. 64% with 1 dose, 64% fully vaccinated, 13% with 1 dose, for a total of 77% vaccinated, leaving 22% of the eligible population still to reach. And then we're hearing a lot of questions about the breakthrough COVID cases. So it's hovering at both the state and the city level at right around 1% of the cases are breakthroughs. So in spite of all that you're hearing about breakthrough cases, it's still very much worth it to get the vaccination. Of the breakthrough cases in Brockton, 8 have had to be hospitalized and 2 of those did pass away. Both were elderly and had other things going on. So that's what I've got today.
That's great, Sue. So I guess we are feeling good for a reason. Things are getting better, and Brockton's doing better than almost all other gateway cities in terms of vaccination rates and in new cases. So that's terrific. It's great to hear.
But also with that note of caution, we thought we were out of this in June, and we researched.
Agreed.
So it's really important to keep social distancing. We started today offering 3rd doses to our employees as healthcare workers. Not everybody is eligible yet based on their risk factors. So that's important. And we expect to be open to children age 5 to 11 any day now.
That's great. Thank you so much, Sue. Appreciate it. Now we're going to go around the horn here and hear some updates on various resources for small businesses. So let's start right in with Margaret LaForest from the Mass Office of Business Development. Hi, Margaret.
Hey, Chris, great to see you. Great to be back with the team here. I'm going to be brief today. I know you have a great agenda ahead of you. So one of the things that is trending, and we talk about often with the Metro South Chamber, is the Love My Local campaign, and of which you've leveraged really well at the Metro South Chamber. So I just want mylocalma.com. I encourage you to connect with their resources. They've got a toolkit that you can download, but you can also hop on the website and share your story. And the Commonwealth is really sourcing that for our marketing campaign. There's been additional funding committed to expand this. And I was on a webinar, I think you've actually had Kiko, the Executive Director of Mass Office of Travel and Tourism speak to this chamber. I was on a webinar with her just the other day, and she shared that, they've done print marketing, digital marketing, social media marketing, billboards, like they've really done a blend of traditional and modern marketing here. But the metrics that they've had on their social media have blown out. The consultant that they've hired says the metrics have really blown things out as far as the reach. So, I think that even though people are starting to travel back again, I think that we really learned about taking advantage of what's in our backyard. So today, I just really want to encourage businesses to share your story, because there's a lot of attention being put on that, a lot of funding being put around that. And then just in general, we want to just share with you that, Sue and I are frequent flyers on here. And we're often talking, and I feel like it's like the fire hose of new information. Here's this program, here's this program, here's this program. But call us, email us. Like, we'd love to schedule that one-on-one. Sometimes we do this with the Metro South Chamber. Back in the day, we were having office hours there. But we'd really like the opportunity to, these callers who connect with us, to have that conversation with you and say, what is happening at your company? What are your pain points? Because there are so many resources, and we can really hold your hand and help you navigate each one. Because sometimes it just puts in the back of your head that here's an idea and I should do that. But you know what? Just getting through the day and operating the business is all you can handle. So when you have some time, you have our contact information. I just encourage you to pick up the phone and reach out so that we can customize what of these tools works best for you.
Thank you, Margaret, and thank you for all you're doing and Susan's doing on the marketing piece, but also on helping employers find employees. I know there's a lot of activity from the state's perspective and really addressing not only training, skills training, but also in identifying staff for various businesses. Sound like you're going to say something.
Oh yeah, no, I mean, workforce development is just like a whole conversation in of itself. And I think really that's what we're hearing, the struggles of the employers hiring. And you have such a great mass hire career center right in Brockton, right in downtown, across from you, our office in City Hall. And, they have a captive audience, right? Everybody who's been paying unemployment has to get connected to a career center. They have to do their job search, where those requirements waived beforehand. So, getting your job postings, screening your candidates, finding out training. There's a lot of funding to upskill employees or invest in training employees so you can onboard the type of employee that you need. So gamut of workforce development and more resources I think you're going to see coming as that federal funding gets released and determined by the legislature. There's a lot of proposal, the governor has a proposal about what to do relative to workforce development. So no shortage of funds, which is kind of a good problem.
Yeah, that's nice.
On that topic. Yeah.
Thank you, Margaret. Thank you for making us aware of the resources that are available. We really appreciate it. Margaret's information for contact is in the chat area, so please reach out to her. She loves to talk to business people. She's very familiar with a lot of the resources that are available, so please do that. Well, now we're going to move to Susan Murray from Seed Corporation. She's the CEO of Seed Corporation. Seed provides services to the Brockton area and has for many, many years. And Susan is CEO of Seed. So welcome, Susan.
Thanks, Chris. Thanks, everyone. It's great to be back on the call. Thank you. It's nice to see everyone. So Seed is ready to help you with your startup business ideas, your expansion ideas, your reopening. We have a multitude of funds for different loan sizes. Our loans can be as small as $5,000. With different programs, we can go up to $5.5 million. The exciting part of the 504 program, which is the SBA acquisition program or refinance for real estate owned by your business, is that it's fully funded under the continuing resolution. I don't want to steal SBDC's thunder, but the rates continue to be close to historic lows. For large equipment purchases, the 10-year rate right now, 10-year fixed, is 2.28%.
Wow.
Amazing. That is, the SBA likes to say that's borrowing at the large corporations rate for the small Main Street businesses. Yeah. We actually have a commercial laundry right now doing about $2.5 million of equipment locked in at 2.28% for 10 years. So it's just incredible. Most people think real estate when they hear 504, but as a reminder, it's also there for equipment. And the 20-year rate for real estate is 2.92 this month, and the 25-year fixed rate is 3.11.
Wow.
So that's in partnership with your bank. The bank would do 50% of your purchase or renovation or project cost. We would do 40 at that rate, and the borrower would put in just 10%. So that's a great way to own your business, you own your building instead of paying rent for somebody else and building their equity. It's a nice way to build equity for your business. Our microloan program, so that is up to 50,000. That's another SBA program. We have plenty of funding under that. And then we have a grant from Mass Growth Capital right now for loans up to 100,000. Our rates are either 5 or 6%, depending on if we have a bank partner, it's 5. If we're a standalone lender, it's 6%. And that's, we feel really below market compared to the credit risk that we're willing to take here. So if your bank has said no, or maybe, or given you only part of what you need, we're happy to talk to you to see if we could fill the gap or lend what you're unable to obtain. So we have technical assistance, one-on-one, we have workshops. We recently translated our website into Spanish and Portuguese, so that's helpful. So if you need anything, any questions, check out our website. And I think my contact is also in the chat.
Yes, I think Emma's done a nice job of posting everybody's resources in the chat. So check that out, folks. And if you have any questions, reach out directly to each of our panelists. And I think she even put up a couple others like Eli and others from the SBA. So thank you so much, Susan, for all you do for our businesses in this area and for all the resources you bring to the table. Very, very helpful. Thank you. So new with us this month is Rosa Termina, and she is from the Massachusetts Small Business Development Centers, which are really a robust offering of workshops and counseling and everything small business. Rosa, welcome. Can you give us an update on I hear there's good news on the 504-7A fees being waived. Is that true?
Yeah, and then I also have some updates on the economic injury disaster loan, which is fantastic for any of the small businesses that have been impacted by COVID. I'm pretty much doing COVID assistance all day long, but it's been a fantastic opportunity to really help all of our businesses. So for the economic injury disaster loan, which is a 3.75% fixed interest loan for 30 years with a 2-year deferment period. It almost doesn't get better than that. Massachusetts, 64,000 Massachusetts small businesses have benefited from these, we call them EIDL loans, for over $5 billion in funding. And right now, SBA is approving $2 billion in loans each day. And for Massachusetts, they saw an increase of $300 million in applications just this last month. The most important thing to remember with the EIDL, funds are expected to run out before the program is scheduled to end. So the program is scheduled to end at December 31st. So all small businesses are encouraged to apply well in advance. The sooner you can get it in, the better. Contact your local small business development center. We actually have contact for our Southeast location, and they'll be able to help you, walk through the application, answer any of your questions. But really a great opportunity to take advantage of this if you can get it.
So EIDL is where we all started with this a year and a half ago. It was the first one that was available. There was some advances available, and then there were loans. Then people quickly moved to the PPP, but EIDL is still there. There's still funds available. So please, if you haven't reached out and you haven't applied for funds that you need for expansion at this point, or if you're rebuilding and getting your business back up and running, this is a great time to apply for those funds. If you have need of technical assistance, which we've received quite a few people who have had issues with the portal, please reach out to us and we will put you in contact with a specialist who will follow it through. Even the chamber here, we had issues with uploading stuff to the portal, and that IT person at SBA helped us, and we were able to get the paperwork processed in a really quick way. So let us know. Rosa, what about the fees? Did you mention that being waived through 2022?
Yep.
Okay. Great.
Yeah, those are going to be waived as well. So, SBA is trying to do what they can to help out everybody as we still kind of weather this pandemic.
And that's big for folks. If you're applying for 504-7A loans, you heard the rates are terrific, and now the fees, the upfront fees, are being waived for this fiscal year. So please, if you haven't done so already, reach out to Rosa, Susan Murray, and Margaret for assistance, and the chamber as well. We also, I think, posted Eli's information there as well. So thank you, all of you, for being with us and offering information. I would encourage our listeners to, again, reach out and contact these folks for more information.